As everyone gathers here and we still get some participants, I just want to thank you all again for attending today. Welcome to Partnering with Youth in Healthcare Strategies to Build Skills, Trust, and Long-Term Well-Being. If you attended a webinar that I've sort of introduced before, you would probably often hear me say that I'm really excited, but I am especially excited today. You're in for a real treat with some of the content that we have. I really think that you're going to enjoy it, and I'm really excited that we're able to present it to you today. So just before we get started, I do want to do a little bit of housekeeping with some reminders. You can hear us, but we can't hear you. Right now, you are in a listen only mode, so we aren't able to hear you if you have questions that way. But if you do have questions, please feel free to use the Q&A button that appears on the bottom of your Zoom control panel. That is where we will predominantly be taking, comments and questions because the chat is turned off for right now. We will have a dedicated portion at the end to go through Q&A, but feel free as we are going through the content, if you have a question, if you have an idea, to put it down using that Q&A button. Additionally, to turn on closed captions, click on the CC button or closed caption, depending on what version of Zoom you have. We ask that you please complete all the evaluation poll questions at the end of the presentation. This is helpful for both us and our funder to see what in the field is important, what do people want, how can we provide this content to you in better ways and better just reach to others that are actually in the field. So we really appreciate it if you are able to do that. And then also the recording, slides, and resources will be shared via email and also posted on the School-Based Health Alliance website. So just a little bit about us, if you don't know already. As I said, I'm Donnie Greco, and I'm an associate here at the National School-Based Health Alliance. We are a national nonprofit that advances the work of school-based health centers. We do this by offering technical assistance, convening the field for networking, and supporting quality improvement initiatives. So today's webinar is part of our NTAP, or National Training and Technical Assistance Partner work, where we receive funding from HRSA, or the Health Resources and Services Administration, to support the work of health centers, particularly as it relates to school-age children. Today, we're talking about strategies for building youth readiness, but we've also done some other work on integrated mental health, vision services, and even healthy sleep. I encourage you to go to our website on our e-library and check those out. So as I said, I'm Donnie Greco, and I'm going to pass it off to the team. Jisoo, I'll take it. You take it.
Yeah, hello. Thank you everyone for having me. My name is Jisoo. I'm 17 years old and I am currently a junior in high school in Portland, Oregon. And I am a member of SBHA's Youth Advisory Council. On the Youth Advisory Council, I work with Kaiten and our other members to create presentations and workshops that we will share at our national conferences. We create content like blog posts for our Youth Health Hub and also collaborate with other youth organizations from around the country to do all of this work. I got involved with the YAC because I saw a post on social media, but I had already been involved with our state affiliate in Oregon, OSBHA, in the past, and I really loved the work that they did. And I've also benefited a lot from school-based healthcare personally in the past. So I was really passionate about what they do here, and I wanted to join. I'll pass it on to Kaiten.
Hey everyone, it's great to meet you guys. My name is Kaiten. I'm 20 years old and I'm from Dallas, Texas, but I attend college in Missouri. I go to WashU, and just like Jisoo, I also serve on the Youth Advisory Council. I joined my junior year, so it's now my third year, and have been able to participate in the National School-Based Health Alliance Conference in DC twice. And then last year was virtual. So it's been a great experience. And I think Jisoo covered some of the things that we do in the council. But yeah, it's really excited. I'm really excited to talk to you today. And I'll pass it on to our coordinator, Harper.
Hey everybody, good afternoon. I also apologize if my voice cuts in and out. I've been doing a lot of presentations this week with Donnie. So I'm Harper Byers. I'm a coordinator at SBHA, and I've been lucky enough to be doing youth development work here for almost 4 years, which is crazy. I work on a lot of our signature youth development programs. Like Jisoo and Kaiten mentioned, I lead our Youth Advisory Council. I help them in their coordination of our conference that happens every summer called the Be the Change Youth Training Program. And then I also run our youth website called the Youth Health Hub and our Youth Development Digest that goes out every month called the Youth Development Digest. I also co-facilitate trainings such as this throughout the year and for our consulting work. So back to Donnie.
Thank you all very much for introducing yourselves. We're really excited today. I just want to go through our learning objectives. So by the end of this presentation, we hope that you'll be able to define youth development, describe how to create sustainable conditions where meaningful youth leadership and development take place, and then identify practical strategies and actionable next steps to build relationships with students. Harper, I'll pass it back over to you to talk a little bit about our Youth Advisory Council.
Yeah, absolutely. So I thought this would be a helpful place to start for folks because we're going to reference a lot of the work that our council does throughout the presentation, just as a healthy example, and because we've got two of them here sharing their thoughts and experiences with us. So our Youth Advisory Council has been happening since 2013, which is crazy and amazing. As I said, I've been involved for the past 4 years. It's a group of students that are really passionate about school-based health centers, about leadership, connecting with one another, and public health in general. We've got a snapshot of our 2025-26 cohort here on the right, and I'll share a little bit more about them through our website, so you can take a look at their bios and learn more about the work that they do. But how they work on our council is they share their expertise on important health topics. That is both with one another through our biweekly meetings where they present to one another on health topics of their choice, and facilitate virtual trainings on those health topics. So sharing among one another, and then sharing their experience with you all in webinars such as this. They also build connections with other youth and their peers who are really passionate about school-based health, about leadership, and about public health in general. That happens again at our conference every summer. And then also in connections that we build throughout the year, we've had other youth advisory councils join our virtual meetings and build those connections that way. And then lastly, they cultivate knowledge and skills about public health and youth development so that when they graduate from our council or from school, they can go on to kind of whatever they like to do, armed with the skills that they're able to use. Some current youth development highlights from SBHA, just some things that we're doing that we are excited to share with you all. As Keaton mentioned, he is currently serving as one of our 2 youth board members on SBHA's board. This is the 3rd year we have done this program. We're really proud to kind of walk the walk and talk the talk. And we encourage you, if you're curious, to learn more about how we were able to do that and what the process of onboarding youth to our board looked like. Please reach out to us. We'd be happy to answer any questions. This is we've hosted 2 webinars this week with our council members. So on Tuesday, we hosted Creating and Sustaining Adolescent Health Programs, and you are joining us today in part 2, Partnering with Youth in Healthcare Strategies to Build Skills, Trust, and Long-Term Well-Being. As Donnie mentioned in the beginning, we will be posting both of those on our website, so you can go back and watch and kind of rehash and relearn. We're also in the late stages of planning for our youth conference this year, happening in less than a month, which is really crazy to say. It takes a lot of work, and I really salute our council members for all of their hard work that they've done over the past, many months to make it happen, and I'm really excited to get us all together in DC. Some of our council members are also currently working on a School-Based Health Awareness Month project for 2027. As probably all of you know who are joining us here today, but if you don't, February is School-Based Health Awareness Month. And so some of our council members are partnering with our policy team, our communications team, and our quality research and evaluation teams to build something really special for the 2027 month. So more info to come. And then lastly, something that just happens regularly throughout the year, but has really sprung up in the spring this year, has been our Youth Advisory Council providing feedback on materials that we make. So anytime that we're interested and able to incorporate youth voice, they are kind of our first line of defense here, and we're able to reach out to them and they can tell us what's working, what isn't working, what will really resonate with youth, and the best way to kind of use language to share what we want to share with students. So yeah, that's what's going on with us.
All right, I think it's back to me again, right? Yes, perfect. Thank you so much, Harper, for that. That's a great introduction. I'm really excited. So as we're talking about youth development foundations, part of our mission in this webinar is making sure that we are routing this discussion in positive interactions. So that's with students and building relationships early and often. And we're hoping that this webinar kind of gives you some ideas on where to start, or if you're already doing this work, how to improve and consistently adapt and move forward with it. But before we go any further, I do want to just kind of provide some definitions so that way we can ground us all together and keep us an understanding of what we mean when we use these terms. So when we say youth development, this is an approach to programming, services, and policy that has preparation and development as its ultimate goal. So it's rather than prevention or deterrence or even like deficit reduction, it's actually intended to help youth meet their physical, emotional, and social needs while also helping them identify goals and build those skills for the future that they can use. So for example, this could look like helping a student develop self-advocacy skills or creating opportunities for leadership or mentorship within their program. We also have youth engagement. And when we say that, we mean actively having the youth contribute to discussions and decisions that directly impact them. This could look like a student providing feedback on room space or design or other communication approaches and how that is from the health center to the other students. Actively contributing is the key here, that active contribution. It's not just, oh, here's a few ideas and we're done. It's consistently engaging, consistently keeping up with, okay, what's going to work? What can we do? How can we adapt and keep moving forward? And then finally, we also have youth partnerships. So this really builds on those first two ideas, and it takes things a step further because it recognizes that young people are not just partners, but they're equal partners alongside those adults. We often say make space with youth, not for youth. I think that's really important to remember as we're going through this presentation. So now talking about why youth development matters and delving into that on this slide, at its core, it really helps improve health outcomes and reduce those adverse behaviors by fostering a sense of connection and support, and also investment into their own sense of well-being. In the school-based health setting, that can really have a direct impact on how students engage with services and honestly with the school overall. It can manifest in many practical ways. So we've already talked about like student advisory groups, which I know in many of the conversations I've had, those are really popular and those really seem to be a beneficial way to gather feedback from students about their experiences. I think it's really important to say that building stronger partnerships is key here. It also really aligns closely with the whole child, whole community or WISC model, and it really connects to 4 of our 7 core components related to youth development. So ultimately, these approaches, they're there to create opportunities. This is opportunities for young people to be supported as they move forward in their academic careers and also onward in life. So as we talk about that youth development is for all students, it really just emphasizes that it's not just certain age groups, not certain ranges. It starts early and it continues as young people grow. And that might look like different opportunities and supports along the way. So for younger students, this could look like just building confidence and communication skills, which we might go into a little bit later in the presentation. But also for older students, it could be leadership opportunities, self-advocacy, or even being involved, again, actively involved in those decision-making. At the end of the day, it's that intentionality surrounding creating spaces where students can feel supported and they're able to grow their abilities over time. So this is our next slide, which is, it just kind of gives a snapshot on youth development and how that can look within a school-based health center across those different stages, from planning and startup to that expansion and ongoing work. Some strategies, again, I keep saying youth council, but I'm going to keep shouting, it's so important. It's such a great opportunity to hear youth voices and to get them involved in the mix. But you also want to have students give their feedback on services or their experiences or involve them in outreach and peer support efforts. This also might mean like more youth-centered approaches like storytelling or giving young people opportunities to share their experiences and perspectives in meaningful ways. What I really want you to take away from this presentation in this slide is that youth development can be integrated in a lot of different ways. You know, these aren't the be-all end-all only ways, but these are some really great approaches that can help take the partnership and have an incorporated youth voice meaningfully. So it's also important, I think, as we kind of keep moving forward to understand that this does not happen in a vacuum. It's a team effort. It's all about teamwork and it's all about that youth development. So speaking of that, I'm going to pass it now over to Harper.
Thanks, Donnie. So as we dive into youth development, I want to highlight concepts that we pulled out a few years ago when we were doing research for our youth development toolkit called Lead the Way, Engaging Youth in Healthcare. This was really born from conversations that we had with students as well as folks who are doing youth development in the field, thinking about, what makes it successful, what is really important to focus on as you either embark on the process of youth development or expand or just start to think about what that looks like for you. What are the things that you really need to focus on? So in those conversations and in those interviews, we pulled out like 7 pillars of youth development. We call them keys because I think they all fit together nicely. We're really going to focus on 2 today. So youth participation models across different strategies for youth development, how adults can make participation matter, what does successful participation look like, and then also developing youth leadership skills. So we'll give some examples across different age groups and hopefully some ideas that you can take home and use in your school-based health center. I'm going to drop a link to our toolkit if you're interested in learning more about the other 5 keys or pillars. You can look there. And then on our webinar on Tuesday, we talked a little bit more about recruiting and retaining young leaders. So I would also encourage you to look there if you're curious about learning more about what that looks like. Another thing that I want to highlight as we discuss and consider what successful youth development programs look like is the things that keep students coming back. So how are you engaging with youth as leaders? One thing that's really important is really cultivating connections and relationships. That's not just between you as the program or project lead, but also between youth themselves. So building networks for students to connect with one another, whether that looks like meetings or small group projects or things of that nature where they're able to kind of have some independent time to connect. But also between youth and adults. So if you have youth that are really interested in learning more about school-based health center logistics or operations, making sure you're able to set up conversations between the people who make your school-based health center happen and are successful, and helping them do some of that independent networking. Establishing expectations early and often is really important. I think it's really important to share what those expectations are with students and what success looks like. And then as you go through, the tenure of whatever your project looks like, making sure you're checking in on those measures of success and expectations and, whether students are meeting them or how you can help them meet them. Just making sure to revisit and remind. Making sure that your partnership with students has really been aligned with a mission, a vision, a purpose is really important. So you're not just, again, as Donnie had mentioned, the difference between youth engagement as just a point of interaction versus youth engagement as a meaningful relationship where everyone benefits, making sure that that's been defined and determined. And then also, seeing if students want to be involved in the determination and defining. If you want to engage students from the very inception of like your project or your youth development strategy, I think that's a really strong way to make sure that youth voice is incorporated kind of across early and often. Again, as kind of part of that establishing expectations early, making sure that you are communicating or meeting on a consistent schedule is really important. So our youth advisory council meets every other week throughout the year. And that is communicated to them at the very beginning of our relationship. And then also we have communication plans and strategies like we text each other or call each other. We meet virtually on Zoom. I email them, things like that. But if you are doing work in person, then maybe it looks like, okay, we're meeting in the school-based health center at 3 o'clock after school or at lunchtime on Tuesdays, and making sure that that's consistent. And if you do have to cancel or reschedule, making sure that that's communicated clearly. Making it practical to obtain and incorporate youth input. I think this is an important thing for anyone to do is looking to what a policy and procedure can look like for people to engage with youth. So that if someone comes in tomorrow and is new to your program, they know the steps they need to take to engage with students and incorporate youth input. It also helps to normalize or standardize that practice if you're asking questions often about how we can involve students, what that looks like, and then how you're going to be able to compensate them for that time or incentivize their time. There are a few ways you can do incentives, and I don't think there's a wrong way. But again, really matching the incentive with your capacity, whether that's financial or time. One thing that we encourage is monetary compensation if you're able. So recognizing that youth time is no different than any other subject matter expert, and being able to compensate them for their thoughts and their ideas and the things that they can provide your program. It can also look like things like snacks at meetings, incentivizing students to show up to meetings, to share their ideas and their thoughts by just getting them in the room and incentivizing their participation that way. And then some other things you might think about is incentives like service learning hours or volunteer hours. If they are taking on additional roles or additional responsibilities, and you know that they're doing extra work, maybe meeting with your school administration and saying, I really think that Jisoo and Kaiten should get, 20 hours of volunteer hours, and signing off on that form. Also seeing what training students are interested in and providing that development that way is another incentive for students to get involved and come back to your program. Okay, I feel like Donnie and I have chatted enough, honestly. So I'm excited to bring in our Youth Advisory Council members to talk a little bit more about what they would recommend for adults and how adults can really show up as partners for students. So I'm going to pass to Kaiten to start, and then Jisoo will follow.
Yeah, definitely. I think we touched on like a lot of great points here. I think the number one thing in order to foster like youth readiness, leadership is transparency and proper communication, as Harper mentioned. So I think if you have an organization and you have some specific goals, but you're looking to get youth involved, trying to be clear and upfront with those goals and communicating that with the youth that you are like hoping to get involved, I think that's the number one thing, so that there's a mutual understanding between you and the youth. And then doing, as Harper mentioned, like periodic like check-ins where you see, okay, is not only like the organization growing, but also are the youth learning? So one thing that I felt like in my time on the SBHA Youth Advisory Council since 11th grade, and I'm now a sophomore in college for the past 3 years, is that I feel like I've learned so much from where I like started. And so when I first started, I only knew about the SBHC like landscape in Dallas, Texas, right? And being on the council and being in like the National Youth Advisory Council, but also the board, and attending the School-Based Health Alliance conference, I've learned a lot about like the landscape across the country and how there's no like one size fits all solution. I've kind of understood like the funding scheme, like many different like topics that I never thought I would like learn before. And so I think this goes to show that it's really important to ensure that like the youth on board are also like learning while like benefiting your organization. And I think that it's extremely important to have this like transparent, open communication. And I found that like during my time on the SBHA Council, like I've had great collaboration with my peers, but also direct support from Harper, who is our coordinator. So she's always accessible, and like if I have any questions or new ideas, she's always extremely receptive. So I think these are like key qualities to ensure that youth are also growing as leaders and developing youth readiness. So yeah, and now I can pass it on to Jisoo.
Yeah, thank you. Kaiten covered a bunch of amazing points, and I would agree with everything he said. In my personal experience, I think one thing that I would really like to emphasize is making sure that you're preserving the opportunity for youth collective decision making. So the very first point that Harper mentioned had to do with cultivating connections and relationships between youth. And I think that's not only important socially and making sure that youth have the opportunity to collaborate with their peers, but also make sure that's part of like the structure of the organization itself. So when it comes to talking to youth about the advice that they have for your school-based health center or organizational directions that you should be taking, I really think that youth can't be treated as discrete parts. Like maybe if it's a survey, youth need to have the opportunity to talk to each other or collaborate on projects, because involving multiple youth and obviously involving youth voice means that you can't just have one person talking for an entire community. And having the opportunity to work with my peers rather than just alongside them, but actually like collaborating and melding ideas has really made it so that I have expanded my own worldview beyond my own experiences and gained greater empathy and understanding, as well as the leadership skills that are necessary for when I graduate and I enter the workforce, higher education, so on and so forth. So making sure that there are always opportunities for youth to have conversations within themselves and with their peers before they are coming to you and making their decisions, as well as making progress as a group is super, super important to me. And I think that has made me a better person on this council. And I think I can pass to Donnie.
Yep. Perfect. All right. So now we're going to go into a little bit about support and skill building. So on this slide, we have the principles of developing youth leadership skills. And when we say youth leadership, that's where we mean supporting youth in developing the ability to analyze their own strengths and weaknesses, sort of set professional and personal goals, and also develop the self-esteem and confidence and motivation and those abilities to carry them out. So it's not just a singular effort. That's what we all sort of been saying over and over again, but it's true. It's more of a consistent approach to enhancing the skills of someone, especially young people. It might mean providing and receiving feedback. Often we've heard people say, okay, well, we give a lot of feedback. That's great. But what feedback are you receiving? How are you taking that back and incorporating those ideas into your health center, into the school, into the work that you do? It's also kind of giving those clear lines of guidance and training. It's recommended to start this early and practice it often. Keep it consistent. Keep going through each of the stages. Don't dismiss students just because of their age. Just adjust how they can contribute and how they can give an impact the entirety of the health center and the services provided. So what does this process look like? This slide really highlights that youth development is just more a process that happens over time. It's supporting youth and building their confidence to express their needs. I think this little road design expresses this very, very well because it often starts with teaching. So that's where young people can build their knowledge and their confidence and their skills to feel more comfortable in expressing their needs and sharing their perspectives. And from there, it kind of moves into practicing. So this is the active doing of it, where youth have opportunities to actually use those skills and use them, like I said, through feedback or even participating in those discussions or taking on leadership roles. And finally, that kind of goes into scaling. And that means you would scale more ongoing and meaningful partnerships, increase the responsibilities, help increase their input, strengthen those meaningful levels of partnership with them across your programs and organizations. Overall, really, it's about supporting youth step by step to help them build the confidence along the way. Right. I believe I am passing to Jisoo. Okay.
Peyton is going to take this one.
Perfect.
Talk a little bit more about, skill building at a young age.
Yeah, definitely. So I can kind of bring in some personal experience. So I actually I go to college in Missouri. So in St. Louis, there's a school that I work at. It's a low income school district, and they have a recently started school clinic there that I actually volunteer at. And I think I've kind of gained a lot of insights from volunteering at this clinic in terms of the way that they make youth feel like these are K-8 children. And so they do a great job, in my opinion, of making these youth feel welcome. And so I think one of the first things that they do is that before you step into the clinic, they hand out a note card, and the young children that are getting care at this clinic can write down their symptoms or what they're feeling. And if they don't know how to write, some people are extremely young, and again, it's a low income district. There's a translator outside who can hey, what are you feeling today? And then can we write about this? And then they bring a little note card in. And I think just this first step, what it does is that it really validates their feelings and the experiences that they're facing or the troubles that they're facing. And then they walk in and then hand the slip to the school nurse who reads it and then asks them to explain more about their condition. And then I think the space itself is very welcoming. There's nice art on the wall. And I think that's one of the things that I think are extremely important in terms of making a school-based center very welcoming is the space and how it's actually designed. And so, there's nice music in the background. There's nice art on the wall for young kids to see, and it makes them really feel oh, people actually care about me. And this is a place where I really can get good care. And then the nurse asks them hey, how are you feeling? And they can point to different stickers. There's it's smiley face, sad face, etc. So it's very easy, accessible for people to, communicate their feelings. And I think overall working in this setting has kind of showed me the importance of the actual building / facility / setup itself in order for students or young adults to receive care, and also validating their experiences and feelings. And one of the biggest things in being a provider at a clinic like this is you have to be a listener, right? And so I think just fostering that this like sentiment that, oh, I really care about, the symptoms that you're facing or experiences is really important. And I can pass it on to Jisoo now.
I believe that we are passing it on to Harper for
Thanks,
after.
Jason. Again, apologies, my voice is fading fast. Thank you so much, Kaiten, for that example. I feel like it's so important to think about the ways that we build skills with students across age groups, and that youth development, as Donnie mentioned earlier, really knows no age, but making sure that you are meeting students with like age-appropriate care and age-appropriate youth development opportunities where making sure that students feel heard, even if, they can't write their name is so important. So some things that you might think about with older students is what professional development you can do. I think that it is really important because it works to help students prepare for what happens once they leave your care. And I think there's so many amazing ways that you can do this, but the number one is just thinking about what trainings, opportunities, mentorships, and even like events are helpful for the youth's own professional development. How can you uplift the work that they do and involve them with, people and programs in your area related to topics that they're interested in? Some examples from kind of my own experience with youth development include a youth advisory council member a few years ago was really interested in grant writing, and they were just kind of curious about what that part of nonprofit life looked like. And so we were able to involve them in building the first draft of a grant that SBHA was writing. And so they were able to join our meetings. They were able to learn a little bit more about what it means to apply, what things are important to include in your application, and just what the selection process looks like. So really from like the start of the process to the end of like submission and approval, and did we get it or not? And so that was really exciting. And the other example that comes to mind is a few years ago, we also had a youth development intern, and they were a graphic design student who was really interested in, visual art, but also like virtual video editing and things like that. And so we were able to involve them in the creation of so many of our amazing graphics that you'll see on our Youth Health Hub website. So they were a part of the process of like building it out, making sure that the graphics and the way that the website was laid out made sense to young people and was related to maybe other platforms that they are using regularly. They made it really fun. So it was a really colorful website. And that was just like a really fun process. Oh, did I lose you? Oh, here we go. Sorry, my Wi-Fi cut out, I think. And then, sorry, one last thing. I think it's really important to give youth an opportunity to showcase their work for many reasons, but I think it kind of helps put kind of a bow on top of the process of growth. Being able to be like, I did this and I finished it and I'm proud of it. So not just filing it away somewhere, but giving them the opportunity to either, present their work to their peers in like some kind of final presentation or publishing it on your website or in your newsletter, things like that. Putting it on your school website or your SBHC social media page is really exciting. And then sharing it across your organization. Maybe you're the first site to have youth involved in a project that they finished. And so sharing it and connecting with maybe other people at other school-based health centers that are sponsored by your same organization who are interested in doing something similar and connecting with them and helping to grow the program of professional development, and helping youth across your state and your region or your area in general just learn those skills and kind of get prepared for what waits for them post-care. And with that, I invite our council members back on to talk a little bit more about their experiences related to professional development skills.
Yeah, I can start. So with the SBHA YAC specifically, I really think that we've had so many great opportunities. Again, I really want to reemphasize the opportunity for collaboration. I think one of the greatest things that I have learned from being a member of the YAC is just the experiences that my peers have and how much they differ from my own, but also how those differences can help us collaborate and make better results. And then when it comes to showcasing the work, as Harper mentioned, I think something that's really essential here is making sure that the showcasing comes from the youth voice itself. So not only is the work created by youth, having the opportunity to direct the way that it is showcased, so maybe choosing the presentation format or doing the speaking themselves, can be a little bit scary at first. I know that like public speaking is ranked as the number one fear in the United States apparently, but it's an amazing professional development opportunity. um, for example, presenting at this webinar as Kate and I are doing, or leading the workshop like we're going to do in the conference, that is something that a lot of youth don't get to do on like a national or even a local scale. And having the opportunity to involve them in the work of making sure professionally that what they have achieved can be communicated in a manner that reflects their leadership as well as their agency is super, super important. And it's going to help them to be more independent and effective communicators once they become adults as well.
Yeah, I completely agree with everything Jisoo said. Definitely, I think collaboration has also been one of my favorite parts of being on the council, just learning so much from like the other council members. But also, I think I've like gained really solid like technical skills as well. In terms of, like I'm preparing for a career in medicine, hopefully go to med school and become a doctor. And so I think I've learned a lot on this council that would actually help me in my future profession, in terms of so we have to present like monthly meetings on like a topic of our choice. So one of the requirements of this is that we do a lot of like comprehensive research and really understand the background of the stuff that we're presenting. And so I think this is really important, in terms of picking out and like parsing through evidence that you see online and then trying to put together like a coherent presentation. And like Jisoo mentioned, working on your speaking skills, presentation skills, etc., where I'll like in a couple of years down the line, I'll be having to give presentations and talks like this. So I think it's extremely important. But also, I'm really passionate about writing and putting forward like my voice in like, I don't know, a writing format. And so, as part of the council, we have the opportunity to write a blog, again, on topics of our choice. So, like, as you can see, a recurring theme here is that like Harper and the other members of the council, they allow us to pursue something that interests us. So these are topics that we're extremely passionate about. We're able to do research on and then able to present our ideas in like a coherent format, whether it's like a presentation or through writing, etc. So I think in addition to what Jisoo mentioned about like the collaboration skills, I've learned a lot of like technical skills that I think will help me later on down the line. And so I'm really grateful to have been a part of this opportunity.
Lovely. Thank you both so much. I know that it's been really cool to also see your growth in those skills throughout the year and the years that you've been on the council. So excited to keep that going and just kind of see where you end up. One thing that is directly relevant to what both of you mentioned, so great job, is specifically related to workforce exploration. I know that this is something that the field is curious about right now, thinking about how we can encourage students to learn about what school-based health centers are, all of the folks that help make them happen, and really encourage them to use this resource and then return and continue to give back to their own community and the way that they received. One thing that has been really cool in my tenure as the coordinator of the council is that we had a student who was really passionate about school-based health because they had a school-based health center. And so they used that resource, and they really specifically wanted to go into dental care in the school-based health center. And so we were able to, facilitate some connections for them as they moved through their school journey. And now he is currently a provider of dental care at a school-based health center in Michigan. So it's really rewarding to see that, from a coordinator perspective of how workforce exploration and encouragement, skill building in that sense can again build those connections and returns to all the work that we are so passionate about. So when we think about workforce exploration, this is another kind of offshoot of the question of like what waits for students once they leave the school-based health center system and care. As they enter their own workforce exploration, what are ways that you can prepare them for that? There are two buckets that I think you can explore as you form some kind of workforce exploration program. The first is really related to career awareness and spreading knowledge about what is out there related to school-based health centers or public health in general. We've seen this through guest speaker series where maybe your school-based health center can host like providers to come and talk a little bit about their journey and how they got their credentials, what that education process looked like, how long it took them, answering questions about what their day-to-day looks like. I know that that is something that, I definitely didn't know about for a long time is what do you do at your job every day? And so being able to just spread a little bit of knowledge about if you're curious about following in my footsteps, this is what's waiting for you. You could also have youth research career pathways independently or in groups, practicing some of those writing and research skills, and then reporting that back to either their peers or providing something written to you. Or you could do something like an informational interview where you assign students a project to go and interview a provider or someone who has a job that they're curious about. Prepare those interview questions, do the interview, and then again, write something up and share it. The second kind of bucket of workforce exploration that you could provide or learn more about is related to more like of a hands-on exploration and focusing on experiential opportunities. The first is just job shadowing. If this is something that your school-based health center is able to provide, where a student follows around someone for a day and kind of lives a day in the life of someone who works at a school-based health center. This could be someone who works at the front desk, helping with intake, helping schedule appointments, things like that, even up to someone who is doing provider work. You could also do a workplace tour. You could invite students from different classes to come and learn more about the space and what that looks like and experience what being in a school-based health center is like if they've never been to your school-based health center, or maybe they're from a different school. And so learning a little bit about what other sites look like. You can also encourage community networking, kind of related to that informational interview assignment of who can they connect with in your community who has either a job they're curious about or an education path that they're wanting to learn more about. And then not the last way, but one final way that you could do this is do something that does definitely require a little bit more capacity on both, the student and the mentor, but doing something like a mentor-mentee program and having something a little bit more long form than the other examples that are listed here. But I think it's it's very much you get what you put into it. So they can be a higher reward, higher work. Yeah, and then I think we're going to move into building trust with Donnie.
Yes, thank you so much, Harper. So as we talk about building trust in healthcare, I want you to think through the questions of what can adults do and how should adults act? Kind of keep those in the back of your mind as we're talking through this piece. So building and maintaining trust. I have to say that trust is honestly one of the biggest pieces of this work. And it's not something that you could just, okay, it's here, we trust each other. No, it's something that you build over time through those small interactions. A lot of it comes down to how young people are treated whenever they walk into a space. Are they being able to speak without judgment? Are educators and those who are in the health center able to be honest and transparent with them and actually following through with what they say they'll do and when they say they'll do it? It's also really important to remember that this work is about those relationships, not just services. How many people can usually tell when they're genuinely valued versus when they're just being checked off of a list? Sometimes trust does get strained or broken. It's possible. We're all human. Things happen. But part of this work is to pick it back up and being willing to acknowledge that, say, hey, we had a little bit of an issue here. What can we do? Let's rebuild it and keep showing up consistently for the students and for everyone involved. That's really the most important thing you can do as you consistently work with youth, as you work with young people. And again, it's not something that happens overnight. I often think, Rome wasn't built in a day. neither is trust, but it's something important that every interaction you do can impact that in a positive way or a negative way. But we hope it be positive based on, okay, we've done this in the past. What can we do in the future? How can we change our approach? How can we adapt and move forward? So with that, I believe I'll be passing it to Jisoo.
Yeah, so I wanted to reflect on some of my own experiences with building trust in healthcare as a patient myself. So, one, I think something that is really, really important is encouraging students to be an active part of the caregiver teams of team decisions when it comes to care. So, just as an example, a few years back after COVID, I had come in to catch up on a bunch of vaccines that I had missed because of the pandemic. And my provider, it was a new provider. We had gone into a clinic rather than my regular pediatrician because they had changed locations for their practice. And we hadn't really met this person before, and we were engaging in a conversation about a vaccine that wasn't necessarily required at my age, but could be received given the recommended schedule. And when we were engaging in that conversation, even though I was the one receiving the vaccine, I really didn't feel like an active decision maker in the process of my own care because the provider was mainly talking to my caregiver. So rather than actually talking to me about what the vaccine meant, its implications for my health and why I might want to receive it, the conversation was really between the adults in the room. And that ended up in a decision where my caregiver was like, let's just put it off for now. If she doesn't have to receive it, then she won't and we can wait. But I personally wasn't really set. I wanted to continue to talk about it and make that decision for myself and maybe even receive the vaccine at that time. However, I ended up leaving the appointment without getting it at all because I felt as if that door had essentially been closed off and the choice had already been made without me really having a voice in it, even though, it was my own healthcare. So I think even when you see a provider and a parent in the room, the parent isn't necessarily going to be the first and only voice that should be talking for their child, even if they're the one who speaks up first. My caregiver obviously had more experience than me going into a healthcare space and had more experience being an effective communicator about my needs because they had been raising me for a while, obviously. But when it came to that point, I was ready to start making my own decisions and communicating my needs, but I wasn't really sure how to get into that door, even though I personally wanted to. So making sure that those conversations take place, and even if you do have to push a little to make sure that the dialogue is happening between those three parties rather than just the two, is super, super important and helps youth to not only become more effective decision makers in the future, but also maintain trust in your abilities as a provider. Another thing I wanted to talk about was repairing trust after it's been broken. I personally have benefited a lot from behavioral health care based in schools, but an experience I had, and again, post pandemic, was that within my own school, there was a really massive trust gap between the student body and then the behavioral health providers that were based in school offices. This had to do with ineffective communication about policies like mandatory reporting. Some students had experiences where they had law enforcement called to their homes without really being made aware of it. And those kind of spread throughout my peer group, and people were really, really freaked out by the concept of talking to providers and potentially not being able to make those active decisions in the transparency of their own information and the direction that their care took. So while working with a provider, I had a lot of trouble personally sharing my own concerns and what direction I wanted to take that care in because I didn't necessarily know what direction I thought it would go. And I also had a lot of concerns about communication with my caregivers and whether or not I would be an active part of that communication process. And something that really helped me rebuild trust in that relationship is when the provider sat me down and sort of talked through why all of those things around disclosure needed to happen. Obviously, we'd been told that these are legal requirements, things that are forced upon us by the district, but there's obviously logic behind those laws and regulations, and it's meant for the safety of youth. So really being sit down, even though it might seem obvious to you as a provider, it's not always obvious to the youth. So before engaging in care, really telling them why certain decisions need to be made and then how those things are going to be happening helps to build trust and also maintain it.
Thank you so much, Jisoo. I love both of those examples, and I think they're really important as you leave this webinar and think about what can happen today, what changes or behaviors can I continue to engage in. And I think it really all comes down to the fact that no matter who you are, whether you are working at the national, the state, or the service delivery level, like everything that you do and we do in the field is for students. And so some ways that you can really take this framework and enact it are through some questions where you can ask at every opportunity, where are youth in this project, in this initiative, in the grant, in this meeting, and in this conversation? What levels of youth development are possible based on, capacity, based on funding, and then also what's mutually beneficial related to either our strategy or what we want to accomplish. And then lastly, thinking about how much funding you can use to make sure that the level of youth development you've chosen is going to be effective based on like the goals and the outcomes that you have in mind. One thing that we really recommend is just making sure you're building in youth development as like a line item into grant applications or consulting contracts. And I think that's a great practice to make sure that, even if you're starting from the very beginning, you have the resources to be able to make it happen. So we've got a few minutes for questions. I encourage folks to, use that Q&A function to ask questions of our Youth Advisory Council members. And I think with this time, I would just invite our council members while people are typing to share any kind of final thoughts they have about how, school-based health centers can help build skills or how adults can really build trust.
Yeah, I can try to take this one. I think just to kind of like summarize what we talked about, I think in terms of trying to build trust, I think the number one thing is transparency and being open and directly involving like youth in the decision making process. As I have the opportunity on the like board and also the council, and then I think going back to what Jisoo mentioned, making sure there's like collaboration both between the adult and the youth, but also amongst the youth themselves in order to facilitate like an exchange of ideas. I truly think this is how like youth learn best. And finally, preparing them for like skills in the future and tailoring like your organization's efforts to something that's going to benefit them. Whether it's more technical skills, like helping them like work on presentations, like making them practice like public speaking, etc., or if it's just like softer skills, whether it's like communication and like figuring out how to like exchange ideas with peers, etc. So I think fostering all of these skills, whether it's like technical or soft skills, can be very beneficial in helping youth develop and become ready for the workforce. Yeah.
Yeah, and just adding on to what Kaiten said, I guess this is a little bit more nebulous, but I think one thing that you really need to have in your mindset when approaching work with youth is not to be scared of the unknown of youth decision making. I think a lot of the fear that comes with granting youth autonomy has to do with like, oh, they're young, they might not know what they're doing, or what if they make the wrong choice for themselves, for this organization and beyond. But I really want to emphasize the really effectiveness and the importance of the work that you do as care providers, as people who provide professional development, because that really is what is making youth those making youth into more effective communicators, decision makers, et cetera, et cetera. And when we start with the anxiety that youth are going to take us into the wrong direction, maybe harm themselves because they're going in the wrong direction, it really prevents the door from opening at all. And that means that when they are becoming adults and when they have the legal responsibility to make decisions for themselves, professional responsibility to do those things, they haven't really been trained in those skills before. So starting young, and even when it is risky and maybe it is something that hasn't really been done before and perhaps will redirect work that you have done in the past, equipping youth to do these things and make independent choices is more likely than not always going to benefit everyone in the room. And yeah, I think that anxiety is obviously really something to be understood, but can be dealt with by actually digging your heels in deeper and making sure that even more autonomy goes towards youth by providing those extra supports.
Thank you both so much for those thoughtful responses. And I totally echo the as someone who was intimidated to start working with students, because I didn't have experience doing it, the way that I thought that was just by doing it, and I think that's true for so many things. And I think just being flexible and being understanding to yourself and to youth, there's so many things that we all have learned. And so, yeah, I would just encourage you all to get started and reach out with questions. We want to support you as you start this work or continue to expand this work. We want to support you in any way that we can. Perfect. I think we'll go ahead and launch our closing poll as we go through just some closing resources and reminders. So I'll hand it back to Donnie to close us out.
All right. Thank you so much, Harper. So please answer that. Like I said, this evaluation is so helpful for us to gather information about what you in the field need, how we can better support you. So please answer that. I will be going through another few slides, but I'll keep the poll up. It has been mentioned a few times, but we would love to have you attend our National School-Based Healthcare Conference. It's in DC. It's happening. Registration is open now. It is an amazing opportunity to network, to meet people in the field, and to really understand, okay, what is everyone else doing? How can I keep actively contributing? And I think it's really relevant to today's discussion too, because we have a lot of specifically dedicated towards our youth, as Harper said, and it's a really important opportunity to kind of see people, hear people, talk to them, and really engage with others and understand. I know that when I went to my first conference in person, I was nervous and was like, oh, I wonder what is this going to be? And it was amazing. It was so great to have people come up to me and talk to me. And I was in a room of advocates. I was in a room of people who understood what we were saying and why we were doing it. And that was just such a magical experience. So I really encourage you to go to our website and register if you're able. We would love to see you there. Also, as I mentioned, please, 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 registration's open for our Be the Change youth training program. That's also a really great opportunity to see what's happening with our youth, what's going on as we keep developing these ideas and what that means looking into the future. So I would love to see you there, love to see you at both Be the Change and the conference. And then here's just a few things that we have from our Youth Advisory Council, just some things on student development and youth development. And these are resources that we will send out afterwards, but I think it's really important just to kind of have them here. I also recommend we have a digest for SBHA, like national news, but we also have our youth development digest. I think that's really important to just kind of see what our upcoming events specifically related to youth, showcasing them and their opportunities. We talked about Be the Change, and we also do offer consulting services. So if you're interested in that, please go to our website. So we have a QR code. Please follow us on our social media. We'd love to connect with you. If you have any questions after this, please reach out. We're happy to answer them. And as I said, please stay connected. We have Facebook, Twitter, LinkedIn, Instagram. We'd love to hear from you. And after that, all I have to say is thank you so much for attending this, for being here, for listening, for answering the polls, your questions. It's a really great opportunity, everyone. Thank you to all of our speakers, to Harper, to Jisoo, to Keaton. It's really great that we all were able to come together and listen to your perspectives and also deliver that information to you. I think we're good then. So thank you so much and have a great day, everyone.
Thank you so much, everybody.